Hey everybody, welcome to Medical Mamas. This is our series where we will be speaking with several physicians who are in various stages of motherhood. So today I am speaking with one of my best friends, Dr. Danielle Henry.
Hi.
Hey, so welcome. Thank you so much for agreeing to talk with us.
Of course.
So Danielle and I actually know each other. We did residency together and she is expecting. Tell us how far along you are.
38 weeks today. Ready to go.
Congratulations.
Yeah.
Are you excited?
I'm excited and anxious. I can't wait to meet him.
You have any names picked out yet? Or is that a
We
secret?
have 2 names picked out, and he's going to be named when he's born.
Awesome. So today we're just going to talk about a few things and take your time. This is a relaxed atmosphere. You're a mom first. That's what this whole series is about. So we just want to know who you are in this space and time that we have going on right now. So specifically with regard to COVID, the coronavirus right now, tell me a little bit about your life pre-corona.
I'm a breast surgical oncologist. I work at a cancer center in downtown Orlando. And pre-corona, I was in a busy breast-only practice, working in 2 locations. And pre-corona, things were kind of in a groove. I don't know what else to really say.
Tell us about your family life.
So family life was pretty good pre-corona. So both of us have immediate family here in Orlando, and we like to entertain. We definitely also like to socialize. So we had a very full social schedule pre-corona, either hanging out with family or friends in our off time from work.
Okay. And do you remember the day when the shelter-in-place orders were put down?
I do. And, actually, we decided as a family that we would start to shelter in place before it was mandated by the county and then later the state. So Orlando shelter in place came a little bit before the state. So early March, we decided that we were going to stay home. And we started to spend a lot of time together.
And so tell me how have you been able to manage work and family life currently with this shelter in place? I know a lot of the shelter in place orders have been lifted, but how were you able to manage the two during that time?
There wasn't, how did we manage it? So once the shelter in place orders kind of came into effect, I don't know, how did we manage it?
Like, did you mostly stay at home during the time period? How did you manage family and friends? What were some of the kind of precautions that you took?
So when shelter in place happened, we had already started implementing some precautions. So we had been staying at home. We decided that we would mostly cook our meals in the home. And one of the things that we had talked about doing in anticipation of the baby was doing more online ordering for food and household items. So pre-corona, Target was kind of my therapy. I would go there once a week and spend several hours walking through all the aisles. And so that was a transition that we made fairly early in, was ordering from Target online and using the other food delivery services to bring food at home. And then we prepared most of our meals at home. And we definitely started to distance ourselves from our friends and family. So we basically were spending the weekends together. And any time that we weren't at work, we were here at home. And then from a work perspective, things for me being a surgical oncologist didn't change significantly as far as not being at work, in the sense that when they took the mandate, or when they made the mandate for um, postponing elective surgery, a lot of the surgery that I do is not elective, and patients don't want to wait with a cancer diagnosis. And so, since our resources weren't limited here in Orlando, we were able to continue with cancer operations. I would say I did have a high level of anxiety during kind of the peak of the COVID
Sure.
period, just because I knew that there was a potential that I would be exposed to the virus at work, um, and how that would affect me and my pregnancy. Most of the data that we have isn't great, but it showed that the baby at least didn't get any vertical transmission of the virus, which I felt a little reassured. But overall, if I were to become critically ill, that would have a huge impact on my pregnancy.
Right.
Um,
Okay.
so I washed my hands until they were raw. I wore an N95 mask. When I operated, I wore 2 masks, and I did what I could to spend as little time in the hospital and as little time in the clinic as possible. I would say one of the positive things that have come out of the whole COVID and changing our practice patterns is that we do a lot of virtual visits now. It was
Mhm.
a steep learning curve for both myself and the patients on getting the technology to work. However, I realized that a lot of visits that I had in the past that were in person are better served for both myself and the patient as a virtual visit. And so hopefully that'll be something that will continue in my practice going forward. So
Sure.
that's been really positive. Um, so yeah.
Oh, that sounds good. So it sounds like, you guys were able to cope, pretty well, and sounds like you have a strong support system there, but in general, being able to be in a position where you can really shelter in place and do all those things. It sounds like, it wasn't, too much of a negative effect on you and your family and your work. So that's great.
Yeah.
What would you say has been the most difficult aspect of all of this for you?
I would say the whole thing has its ups and downs. You know, the difficult aspect of it is that thing. Okay, so I would say there's several things that have been made this time difficult. So one is that expecting a baby and everything that goes around with preparation for expecting a baby is uh, happy time, a
Right.
ceremonious time. And so having to come to grips with a lot of things that I would have done had coronavirus not been going on, has been a little challenging. So things that you take for granted, like having a baby shower that had to be converted to a virtual baby shower, um, you know, being able to spend time with my mom and my brother and then being able to feel the baby move and things like that are things that we really haven't been able to do so much during this time. Being able to have a prenatal visit with the pediatrician, that's another thing that we can't do. Um, Having maternity photos, just little things like that
Right.
are all things that we have decided, for our best interests and safety, that we will have to give up. But, I will single-handedly give up all of those things just to welcome a healthy baby boy into this world. So, and the grand scheme of things, as difficult as they may seem in the moment, in the long run, I think the sacrifice is worth it.
Yeah, definitely. I think people fail to realize, how much human interaction is so important to our daily lives. And, just like you mentioned, the simple act of having your family members touch and feel the baby move, there's something, there's so much of a connection there that is lost with the social distancing and the mandates. But at the end of the day, and that's why, I wanted to do this series, we're all mamas first. And so, being a doctor, being a wife, all of those things, at this point in time, it's almost like mama first. And so that's what comes into play first. And so, we're willing to sacrifice all those things just to make sure our child is healthy. And so, but things that people need to, consider and think about when they see, a pregnant woman or something like that during these times, it's a little bit of a hard time. Um, so name one of the most positive effects that maybe this whole situation, the shelter in place, social distancing has had on you and your family. We talked a little bit about work and how it changed, maybe enhancing some of the virtual visits and things, but tell us a little bit how it may have changed your personal and your home life.
I think that the positive thing that's come from the whole shelter in place and coronavirus from a personal perspective is one, I've had more time to be at home to declutter. So one of the things that we really needed to do to make room for our new baby is to get rid of things that we didn't need. So a lot of time to get rid of things, organize things, clean little corners that hadn't been clean. So that's definitely one positive thing. And then it's also been a time of growth for us in our relationship prior to the baby coming. So we've been able to spend a lot of time with each other, talk about parenting styles, talk about relationship goals, all those types of things that sometimes what I didn't realize is that the fast pace of being busy at work, coming home from work late, doing things on the weekends doesn't really lend itself a lot of time to do. And so
Right.
that definitely has positively impacted us and brought us closer together during this time.
Oh, great.
Yeah.
And is there anything in retrospect now, if you had to start from scratch with the whole social distancing thing, is there anything that you would do differently?
Hmm. What would I do different? Um,
Or nothing? Maybe, if it worked, that's great.
I don't think we would do much different in retrospect. I think when we decided that we were going to start kind of our own shelter in place, that was a good time for us, and that worked well. And no, I can't think of anything off of the top of my head.
Well, good, good. So we're going to switch gears a little bit because we are battling another pandemic right now. Racism is quite the pandemic, and it is very much in the forefront these days. With the recent killings of Ahmaud Arbery and Breonna Taylor and George Floyd, tell me a little bit how that has had an impact on your daily life.
Well, huh, that is a good question. So, it's impacted me in several ways. So I think the biggest thing is that it has forced myself and I think everyone else around us to confront something that we know that's there. And so for me, I fully understand that racism exists. And I think sometimes we just kind of get used to the fact that it exists. And sometimes it's to a larger degree, and sometimes it's to a lesser degree. And how things have played out recently has challenged us to look at it in the face. And so it's not something that we can just kind of move away from. And we really have to look inside ourselves and everyone else and what we can do differently. So, that has been the biggest thing or the biggest way that it's affected me. And so, with that being said, emotions are high, not only because of how it personally affects me and my family, but also because I'm pregnant. And so it adds an additional layer of sentiment to what's going on. Um, you know, I think so. Oh, how do you put it into words? So one of the things is that over a year ago, um, my husband had the unique opportunity to give a presentation to a group of people here in Orlando, and his presentation was talking about what it meant to be Black and how he could dispel some of the stereotypes of being a Black man. Um, and one of the parts of the presentation was talking about why that was so important for him to talk about, and why it was is because one day he may have a son, and he wanted to make sure his son didn't have to face the same types of things like Trayvon Martin or Tamir Rice. And the irony of it all is that now we're expecting a son in the middle of all that's going on. And so it's been personal. It will always be personal. And I just hope that from everything that's going on now, that even though it might be a turbulent time that he's coming into the world, that when he gets older, it'll be a better time because of what we're going through now.
Yeah, definitely. Definitely. Yeah, I was just going to mention, the fact that you are, expecting a son. And so have you had any conversations about what some of the conversations will look like in the future?
No.
I know it's early, but I was just curious.
It's it's hard to think about anything other than wanting to hold him so close to me and keep him safe and out of harm's way. But it's something that I think about all the time. One of the songs that I play for him quite regularly talks about the perils that will come in life for a young man in this world. And I think about that a lot. And I don't know how I'll explain it to him, but I know my husband will have a lot of life experiences that he can talk to him about. The biggest thing we have to decide is when do we break his innocence,
Right.
to better help him understand how the world will accept him.
Right. Right. Yeah, because just like you said, breaking the innocence. Children. A lot of people today say, "Oh, I don't see color," which I don't think is the best way to respond to some of the conversations about racism. But when you think of children, they really don't. They don't see color, and so how do you decide when and where it's appropriate to bring that reality, to your child for them to really understand, I'm different, because that's what it, truly means. And so that takes a lot of time and consideration, and even courage on the parents' part to be able to broach that subject, and just like you said, break your child's innocence. So blessings to you and your family, and we'll all have those difficult conversations in the future. But like you said, hopefully these times that are going on right now, the people that are standing, the people that are being allies, the people that were previously silent that are no longer silent, hopefully they will make those conversations a little bit easier for us and our children. As you know, I have a 16-week-old, so same thing with her. We're dealing with Breonna Taylor, so it's not about a Black male thing; it's about a Black thing in general, and the color of your skin. And so we're just hoping that when our children play together, that they have a better time of it than what's going on right now. Well, thanks so much for talking with us today. Do you have any questions for me? Anything you want to ask me?
What's the best piece of advice for a mom that's within days to weeks of her delivery date?
So I'll just say right now, all you need is the baby, the boob, and a bed. 3 B's. So anything else that you don't have right now, doesn't matter. You have plenty of love. You'll bring that baby into the world and he'll be perfect.
Excellent. Well, that's great advice. Thank you so much for having me today.
Thanks so much for joining us for this series of Medical Mamas. Stay tuned for more interviews.